For more on this, I'm joined by Dr. Selanikio, a former outbreak investigator for the CDC and attending physician at Georgetown University Hospital. Good to have you back on CGTN, Doctor.
Thanks for having me.
Of course. Now, we're seeing more daunting statistics, record hospitalizations, infections, deaths here in the US, and we believe this doesn't even reflect the peak of Thanksgiving cases yet. What is this country doing wrong?
I think that's a big topic. I think certainly in the United States, as you know, the pandemic has become politicized. I think people are really starting to take it more seriously now. Of course, we're already 9 months into it. But I think we'll have to see under a new administration whether or not mask wearing, for example, they're able to actually enforce or promote a mask mandate and take other steps, which I think probably should have been taken long ago.
Yeah, I'm glad you brought up masks because President-elect Joe Biden says he will ask the nation to wear masks for 100 days once he's in office, and the CDC also now recommending masks indoors when people aren't home. But is this too late at this point? Because this guidance was given by nations, months ago, as you said. 9 months now we're into this.
No, I wouldn't say it's ever too late. I mean, at this point, we have an infectious disease outbreak, and we can stop infections from occurring. Right. In the same way that we could have stopped them from occurring back in March or back in June. The difference is the water that's under the bridge, which is to say the hundreds of thousands of lives that have been lost as a result of perhaps not following those recommendations. But no, I don't think it's too late at all.
Okay. Well, so the UK will soon roll out the first COVID-19 vaccine. Do you think the UK rushed through the process, or is the US being too cautious? Basically, why there, not here?
Well, I mean, keep in mind, there's a spectrum, right? I mean, China's already vaccinating with its own vaccine for COVID, as is Russia. And so countries have different approval processes, and certainly it's an open question as to whether they might meet the needs or meet the specifications of the FDA. I understand that Dr. Fauci had initially been seen to have been criticizing the British regulatory apparatus for approving the COVID vaccine so quickly, and then later sort of backed out of that. I don't think that without the detailed knowledge of exactly what the British have done, that either I or anyone else can criticize whether or not it was sufficient. And also keep in mind that what is sufficient depends on the gravity of the situation. Certainly, I think it's very likely that the British would have taken much longer period of time to investigate the efficacy and safety of the vaccine if we didn't have this public health emergency going on. And so it's a balance, of course, between what one might do in normal circumstances, but also the exigency of the moment.
You talk about safety. It is, of course, on everyone's lips, especially in light of how quickly these vaccines have been developed. What do you tell patients who are skeptical or reluctant to receive such a vaccine?
Well, I think at this point, the safety data is looking very good for all the vaccines that we're talking about. Well, I don't know anything about the Chinese vaccine or about the Russian vaccine, but certainly I think for example, the Pfizer, the Moderna, and the AstraZeneca, so far the safety profile is good. But you have to balance the fact that, of course, we only have a certain period of time of safety information, and you have to balance that against the fact that we don't know, for example, if long-term effects might be shown over the period of a longer period of time, and then balance that again against the risk of COVID. So, for example, if you're a healthcare worker, as I am, and you're exposed in the hospital all the time to sick people, certainly, I think for you, the decision is quite easy that you want to protect yourself against what is a real and immediate and daily threat. Likewise, I think if you're immune compromised, if you're elderly, if you're otherwise in a particularly high risk situation, whether because of increased exposure, such as in, let's say, healthcare workers, or whether because of increased vulnerability, such as the elderly or transplant patients, I think that's a different equation than, for example, I'm 21 years old, should I get the vaccine? It's going to be a tougher sell, I think, to those who see themselves as less exposed or perhaps less vulnerable than I think it is to the people who are more exposed on a daily basis, as I said, and the people who are clearly more vulnerable. And that's going to be a question of public messaging that has to be rolled out. Again, in the United States, certainly we've had difficulty even with messaging around basic things like masks.